today we're going to be performing trach care and suctioning on a patient. First, we're going to make sure that we have all of our supplies together and that our patient understands the procedure and what's going to be happening, and that we have the right patient, of course. All right, let's get started.
So for the video, I'm going to be the teacher, instructor, and also Anne's help. So I'm going to go through the list and walk Anne through each step to make sure that she doesn't miss anything. So for the first thing, you always provide privacy for your patient. You come in and you do your identifiers, which Anne has already done so. And you're going to explain the procedure, make sure they understand the procedure, and ask them for permission. So next, Anne, we are going to perform suctioning.
Going to put a towel down over just in case when they cough, if they bring up any sputum or anything.
So before suctioning, we are going to make sure that it actually works before we stick it into our patient. So for the suction, it should be between 80 and 120. And you're going to use water. You're going to put it in the water, and you're going to do intermittent suctioning. Make sure that it works before you put it into your patient. So you're going to go ahead and you're going to put it in until they start coughing, and then you're going to pin roll it out while doing intermittent suctioning. You're going to give them a 1 minute break in between, and you're not going to. How many times are you going to do it?
I'm only going to do it twice.
Okay.
Then I go in again, and I start pill rolling and intermittent suctioning, and that's it.
So now you're going to remove your old dressing, and you're going to note that in this case it is actually the wrong gauze being used. You're going to note any drainage, the amount, the color, if there's any odor, and you're going to discard and then set your stale tray up.
Okay.
So now that she has her stale tray set up, I put on an extra pair of gloves to be a helping hand so she doesn't break sterility. So now she's going to go ahead and she's going to check the date of the saline, make sure it's not expired, there's no leakage, or if it's a new bottle, she doesn't have to lip it, but and with the normal saline, if it is already opened, then she has to make sure she lips it with the label on the inside of the hand so she doesn't contaminate or ruin the labeling of the normal saline. So after she poured the normal saline into her sterile dressing tray, she's now going to take the inner cannula out of the tracheostomy, and she's going to let it soak in the normal saline to loosen up all the crud to be easier to clean. So after that, you're going to remove your dirty gloves and you're going to don sterile gloves. Okay, so now that she removed the inner cannula, we are going to take some gauze with some normal saline, and we're going to start cleaning the faceplate while maintaining sterility. So you let me know when you need a hand.
So I clean the faceplate first, I'll turn around, and then I toss it. And then I'll have Jessica hold the faceplate up so I can get beneath the faceplate. And then throw away. That's it. And then you have to make sure that you dry. And I'll have you grab that faceplate again. Dry beneath it. And
So now that it's cleaned and dried, we are going going to use the gauze
That's already pre-cut.
that's already pre-cut. You never cut them yourself because then you get little stranglies and it'll irritate the opening. So now you're going to make sure that you maintain sterility of the side that's going on. And do you have an extra Q-tip there?
Sure.
Just use the Q-tip and grab it and push it up. There you go. So after you're done cleaning, you're just going to let it rinse off in some clean, normal saline. And then you're going to take the pipe cleaners and you're going to dry the inner cannula as best as possible, so they don't get any moisture when they're breathing. Okay, so now that it's clean, now you can place the inner cannula back into the tracheostomy. And make sure it clicks and it's locked. At this time, normally we do change the ties, but where they're not visibly soiled, you don't actually have to change them every time you clean it. So that is the end of tracheostomy care and suctioning. So after the procedure's all done, now you can clean up and you can discard everything. If there's any sharps, make sure they go into the sharps container. And after you take off your gloves, you're going to perform hand hygiene. Okay, and what are you going to document when you are finished?
I'm going to document if there was any drainage on the old dressing that I've done, or that I took off, sorry. And I'm going to document what the site looked like. And then, like, if there was any of the crud on the inner cannula, I want to make sure to document that, just so other nurses know. And how the patient tolerated.
Awesome. Good job.
Oh.
Okay, so what are your 4 Ps?
My 4 Ps are pain, position, toileting, and possessions.
And what are your 3 safeties?
I'm going to make sure that both of my bed rails are up. And my bed is in lowest position.